Cancer remains a major public health concern, being the third leading cause of death in Kenya. This has further been highlighted in a report dubbed the Status of Cancer in the Country 2021-2022. The report has been launched in Nairobi in the first ever Cancer Summit, attended by health workers and stakeholders from across all sectors. The summit reviewed the progress made over the last 10 years in addressing the cancer burden. And as our very own Gloria Musimbi reports, the report indicates that 70% of the cancer cases are diagnosed at advanced stages, with 2 out of 3 persons succumbing to the disease.
The Status of Cancer in Kenya 2021-2022 report has shown that 46% of the cases of the disease in the country are in a bad stage. According to the report, children under the age of 18 who suffer from cancer account for 2% of all cases that have been reported and recognized so far. The counties of Nairobi, Nakuru, Kiambu, Machakos and Nyeri are leading in cancer cases in the country, with 25% of the patients being between 1 day old and 29 years old. 75% of all cancer cases in the country are from victims within the ages of 30 and 84.
County governments have made significant investments in cancer treatment. Mombasa, Nakuru and Garissa counties have, for instance, developed state-of-the-art cancer centers that are able to provide referral services for neighboring counties. We shall follow on that trail.
For women, the type of cancer that has become a major concern in the country is that of the breast, leading at 26.5%, while vaginal cancer is the second at 23.2%. Speaking at the launch of the report, Health Cabinet Secretary Susan Nahumincha has announced that they will be phasing out the National Health Insurance Fund, NHIF, and replacing it with National Social Health Insurance Fund that will provide people at the grassroots with easy alternatives of funding by the government for cancer treatment.
Our new administration, through the Kenya Kwanza Health Plan, has envisioned a chronic disease fund that will further bolster the financing for cancer intervention and stem the capital flight due to medical tourism for cancer survivors.
In addition, CS Nahumincha stated that they will collaborate with stakeholders in the private sector to strengthen primary health care for affordable screening and diagnosis.
Public-funded treatment services have been enhanced through the establishment of more than 10 county chemotherapy centers, 3 regional comprehensive cancer treatment centers in Mombasa, in Garissa and Nakuru, and the Cancer Center of Excellence at the Oncology Center at Kenyatta University Teaching and Referral Research Hospital, where cutting technologies such as molecular imaging and cybernerve treatment have been made available for all Kenyans.
On her part, Dr. Shalene Biwott has encouraged women to make it a habit to visit health centers regularly for screening to determine the extent of the disease and prevent it at early stages.
We have the World Cancer Day on the 4th of February. This is this coming Saturday. I believe we have various stakeholders who have come out and rolled out free cervical cancer, free other form of cancer screening camps, and even screening for just non-communicable diseases. I would urge Kenyans, if you see the posters online on the social media platforms, like for example, I've seen Nairobi County has already rolled out screening. On this Saturday, we're also going to have screening at as part of this summit at Kasarani. Come out in large numbers, come for the screening, come get checked, and I would assure you, if detected early, cancer is preventable.
Kenyans, especially women, have been encouraged to come forward for free cancer screening, as Kenya is expected to celebrate World Cancer Day on the 4th of February in an event in Garissa County. The Ministry of Health through the National Cancer Institute of Kenya have today launched the Status of Cancer in the Country 2021-2022 report. Cancer, being the third leading cause of deaths in the nation, remains a public health concern. Local and international stakeholders have today met to evaluate the progress made in the war against cancer. Reporting for Hope TV News Watch, Nairobi County, I'm Gloria Musimbi.